Now, you're watching Wave 3 News Listens Live.
And it is a celebration.
With your host, John Ramsey.
And welcome into the Wednesday edition of Wave 3 Listens Live. We talk a lot about first impressions and the importance of first impressions, and they certainly are. Also, the ability to enjoy life. That's important as well, and that's why we're going to talk about Freedom Mini Dental Implants with Dr. Regan Ackerman, who joins me once again. Okay, first impressions are important, but it's not all just about the cosmetic look. But, you know, having a nice smile that you're confident in, that is important to people, isn't it?
It's very important. Definitely the nice smile, but like you said, it's not always about the smile. Functioning, eating on a daily basis, that's what a lot of my patients come to me for, because they are struggling wearing dentures. They hate their denture. They hate using all that glue, and they just want to be able to eat again. They want to go out to a restaurant, be able to choose anything on the menu and not have to pick and choose, not be on soft food diet, not have to excuse themselves to go clean out their denture or worry about it flopping on the table and things like that. So those are the people I help with these mini dental implants.
Yeah, and it really, that's what's great about this show, is sometimes people aren't aware of the technology that is available. Now, this technology has been available for about 20 years or so, but if perhaps it's been 20 years that maybe you went into an orthodontist who said, oh, you're not a candidate, or we can't do this, or that they talked to you about how the process and how long it was and how painful it can be, and you thought, no, this is not for me. Well, the game has changed. Dr. Ackerman, if you would, tell us a little bit about what you do, or a lot of it about what you do and how it has changed.
Yeah, so just like you said, if you haven't been to a dentist in 10 or 20 years, you know, especially if you have dentures, you didn't have a reason to go. So this new technology with these mini implants, one of the biggest things I do is what we call a snap-in denture, where the denture can snap into these implants, and I can kind of show this model. Yeah. Go ahead and do that if we want to do that.
We'll take a close up here. And so this is your gum line, right? Yes. This is not plastic.
Yeah, so imagine this is your mouth without teeth, and then these are the mini dental implants, and they are so minimally invasive. When I place these, you know, I just numb the gums up a little bit. I'm not making any incisions or sutures. It's not major surgery. You know, I just, you know, place these implants, and the day I put the implants in, you will leave with your denture snapped on to those implants. And then you no longer have to wear denture glue. You've got that confidence and that security to know, I mean, I'm tugging on this thing, to know that your denture is going to stay in. And you can go eat more foods and just have that freedom to smile and eat again. And like I said, the advantage of these mini implants is that because they are so minimally invasive and so much smaller, I don't have to have a lot of bone to place them. So a lot of people that thought they weren't candidates for implants or things like that, now they are candidates with these mini dental implants.
And in fact, it's very, very rare that you say, no, you're not a candidate.
It is pretty rare. I would say like 95% of the people that walk through my door, I can tell them that they are a candidate for these mini dental implants. It is pretty rare that somebody doesn't have enough bone for these.
Fantastic. So, yeah, and the part about enjoying life, not only with a confident smile, but also being healthy, because as you know, some of the more fibrous foods, those are the ones that are hard for denture wearers to eat. Things like peanuts, which are good for you, green leafy vegetables, steak, anything that you have to chew, and some of those foods you probably really enjoy and miss, you don't have to miss them anymore. Just go to Freedom Mini Dental Implants. Now, there is another procedure that you perform, and this one is really cool. This is like your third set of teeth, right?
This is definitely the nicest thing we do, where you can get rid of the denture completely. And with this option, so same thing, you know, imagine this is your mouth, your gums without teeth. We're just going to place more implants, but we place them the exact same way, minimally invasive, no incisions, no stitches, you know, place them all the same day. And then we're able to make this bridge of teeth. And these teeth cement, kind of glue onto those implants.
No plastic.
No plastic, and it's permanent. And then you no longer have anything on the roof of your mouth. You can taste your food again. And like I said, these are permanently cemented in your mouth. So like you said, it's like your third set of teeth. It's the most, you know, natural way of replacing your teeth. You brush it like you normally brush your teeth. We give you a water pick, a little water flosser to kind of keep the edges clean here. But this is life-changing for people, you know, when they do this. You can eat whatever you want, taste food again, you know, get rid of that denture completely. Actually, I had a patient come in today Another reason a lot of people do this is on their lower jaw. A lot of people have a lot of excess bone on the inside, and they can't wear a denture. They're not candidates for dentures. So we can do this option for them, and they don't have to go through that big surgery, what we call tori removal, and have to have all that bone removed. So this is a great option for people in that situation as well.
I'm telling you, it is life-changing.
It is.
And making people happy. Yeah. If you have a question, 571-5263, maybe you or a loved one would love to throw away your dentures. Wouldn't that be nice? All right, before we move on here, proof's in the pudding, okay? We want to see some before and after pictures. You're always nice enough to share a patient with us. So today we're talking or looking at Chris, right? Chris.
Yes. So he came in. I couldn't even really get him to, he smiled obviously in this picture. This is before, but had some ill-fitting dentures, no teeth, just very unhappy. Couldn't eat, do what he wanted to do, things like that. And then we did the snap-in dentures for him and finally got him to smile.
Look how much younger he looks. That's a genuine smile.
Yes. So, and he's just so happy. He's a truck driver and he eats a lot of snacks on the road and everything. And so now he can eat what he wants to eat, and he just, happy to have the mini dental implants and not have to use denture glue, not have to worry about, I don't even know if he was wearing his lower denture because it was moving around so much. So many people carry their lower dentures in their pockets because they don't wear them. So he, definitely looks great there. So.
Yeah, I can see the confidence in his smile, and you can have that confident smile as well. Again, any questions that you have, 571-5263. And there's so many advantages. In fact, I've asked you this before, Dr. Ackerman. Really, what is the downside? Okay, because we know it's less invasive. You've talked about that. Don't need the glue. You're going to be able to eat the foods that you love. It costs less too.
Costly.
Yes, less costly.
Usually it can be about half or a third of the cost of the surgical implants. So that's one of the biggest reasons I got into this, is to give people an option that didn't have an option. Either they were told they weren't a candidate because of their bone, or financially they just couldn't do it. And this definitely gives people, another option to consider. So.
Let's talk a little bit about the demographic that you serve. Okay, what kind of ages are we talking about here?
Everywhere. This morning I did a 19-year-old. He was born without one of his front teeth.
Just one, and you can do one.
Yeah, we just did one tooth. He'd been wearing a retainer with a fake tooth on it 24/7, and those retainers can get pretty dirty and gross looking after time wearing them that long. So we were able to replace his tooth. We put the implant in today. He left with a tooth, and it was really nice to be able to give him that opportunity. But so as young as 19 to as old as, we've done 90-year-olds before, age, there is no limitation on the age. Definitely. So, and I know a lot of older people worry about their medical history too, and this is so minimally invasive. I usually don't have to take people off of any of their medications. I don't have to take you off blood thinners, things like that. It's pretty rare that you have a medical condition that says I can't do these.
All right. And again, if you have any questions at all, I have one for you. Okay, so how durable are these? How long will they last, Dr. Ackerman?
Yeah, the goal is forever. Yeah, they're been proven to be just as strong as the traditional and the surgical implants. So yeah, we want them to last forever for you. So. Definitely.
All right, if you'd like to give us a call, 571-5263. We're going to go to break. And before we do, we'll throw up the information up on the screen. If you have a question, are you a candidate for Freedom Mini Dental Implants? And if you are, wouldn't it be nice? We can throw away those dentures. She has bags and bags of them at the office, and people are thrilled with it. So again, give us a call, 571-5263. We'll be right back on Wave 3 Listens, and we are live.
Save the date, September 18th and 19th for the Kentucky Conference on Leadership and Diversity at the Kentucky International Convention Center in Louisville. This two-day conference is packed with an all-star lineup with a focus on leadership development, diversity in the workplace, women in leadership, increasing disability awareness and job accommodations, and so much more. Featuring keynote speaker Tamika Catchings. Learn more and get your tickets now on wave3.com.
Your loved one can receive quality long-term care and protect their assets. don't go broke in a nursing home. Attend our next free workshop to learn how.
Our guest speaker will be elder law attorney Steve Langdon of the McNeely Stevenson Law Firm. Mr. Langdon will show families how to protect their hard-earned dollars.
Let our team help ensure you don't go broke in a nursing home this upcoming Monday or Tuesday.
It's easy to register and absolutely free. Go to freeworkshop.com or call 855-LARRY-55.
Welcome back. Dr. Regan Ackerman is here with us. Freedom Mini Dental Implants, and 571-5263 is the number to call for any questions that you have. You mentioned the fact that you can do a single tooth, 2 teeth, whatever the need may be. How does that work? Can you show me with your model there?
Definitely. So yeah, kind of what I was talking about before with my patient this morning. So he was missing just one front tooth here. So we were able to just, replace a single tooth with a mini dental implant. Same process, very, minimally invasive, no major surgery. And a lot of times too, with the surgical implants, you have to wait like 6 months before you even get your tooth. With us, you're going to leave with a tooth that day and get the permanent one, 4 weeks later. And not only can we just do a single tooth, a lot of people are, maybe missing their back chewers, their molars, or have a partial that they want to get rid of. So we can do, 2 or 3 teeth at a time, really any combination for the most part, but same thing. And then we, make a bridge here where the teeth cement on and glue onto these implants. And then they're in there permanently. They do not come in and out. You use your water flosser to keep it clean, but then you can get rid of that partial. So many people have a partial that covers the roof of their mouth, and they hate it. And we can replace those back teeth and give you something to chew with. Or, like you said, if you were in an accident or born without a tooth, we can do just that one tooth, replace it. So, the mini dental implants, there's lots of options and lots of ways that we can use these. So,
all right, and I think it's important to point out free consultations, right?
Yes, yeah. So it's a free consultation, and usually it's a free X-ray as well. We have a 3D X-ray, to make sure that's how I know about, if you have a phone and everything. But definitely, all you have to do is call our office and set up an appointment for a free consultation, no charge. I'll spend time with you, look at your X-rays, look at you. We'll discuss your options and go over cost and everything like that.
All right, let's grab some phone calls. Dr. Regan Ackerman is here. All of her expertise available for Carolyn. Carolyn, welcome to the show. Thank you for calling.
Yes, I have a question. I want to know, I've got a lot of broken teeth in my mouth now, and I really want to get the many dental implants. My question is, who takes those old teeth out? Do you guys do that, or do you have to send me somewhere?
So we do still refer you to an oral surgeon for the extractions. But I've got, several great oral surgeons that I work very closely with, and they know what I do, and we work very well together. That's the only thing that we do not do in our office is the extractions. But everything else, start to finish, will be done in our office. Impressions, any relines, any adjustments, placing the implants, everything else is done in our office. But the extractions, we do refer you to an oral surgeon. That's a great question. No.
Okay, I'm curious. So if someone had 1 or 2 teeth, obviously they want to match. So you can color match the teeth.
Oh, for sure. Yes.
And now for those who want to throw away their dentures, I am guessing the preferred color is super white.
White. White as you can get it. So, yeah. Everybody's different, though. You'd be surprised. Really? There's a lot of people that do want them just to look natural and things like that. But if you want white, and white is what you get. So,
glow in the dark white,
yes,
is that what you call it?
A lot of people, and a lot of times we can do what we call a try-in, where the teeth are set in wax. So people get to see them in their mouth before anything is a final product.
Oh, that's
and
nice.
That's really important. That way they get to see it, make sure they like everything before, they have to, it's accepted. So,
okay,
yeah.
I'm curious, as far as the satisfaction level, are more people concerned with their looks, their cosmetic look, or more people concerned with, I'm tired of the glue and I want to eat the foods that I enjoy? Or maybe it's a little of both.
It's probably a little of both, but honestly, I think functionality probably trumps aesthetics, because a lot of people are just so frustrated with not being able to eat, not being able to wear anything. Of course, we make them as aesthetically and as pretty, that we always strive for that, but it's probably about 50-50. Some people do come in, they have a denture that they just hate the way it looks. But functionality is a huge one, because who doesn't want to chew,
Yeah.
Oh, for sure.
And you and I, we talk a lot about the foods that you miss. So does that topic come up a lot when you have them in the chair and you're talking? I say, I miss Pretzels, or I miss steak.
Steak,
Yeah.
corn on the cob, peanuts. Yeah, everybody has their favorite. Vegetables, just crunchy vegetables. I think I've mentioned it before. I had a patient come in after she had her treatment done. She's like, I finally got to, chew on a cracker and hear that crunch again. I haven't heard that crunch in so long. Things that we take advantage of that a lot of people struggle with eating because of their dental situation.
Yeah,
So.
I can understand that. It's all very interesting. So how fast is the process? We know that it's less invasive. I mean, really, it's just a little bit of numbing, and then it's like a pinprick, and that's it. No bleeding, no surgery. So we know it's less invasive. How long does it take to get all of this done?
Right. So when we do the snap-in dentures, once, if we have to make you new dentures, but once we have your dentures ready, the day I place the implants, you leave with the denture snapped in that day. So that's a same-day process. Other things, she was talking about having to have teeth taken out and things like that. Usually we do allow for 4 months of healing, but they're never going to be without teeth. There are ways, that you're always going to have teeth. And when they come for the free consultation, I can explain that process and how that works. But yeah, I mean, the old traditional surgical method, I mean, it could take up to a year before you got your tooth or were able to use that implant. For us, if there is any waiting, you may have to wait 4 weeks, because the tooth goes to a lab to get made or things like that. But still significantly less time than the surgical method.
If you have a question, 571-5263. Okay, I'm curious about how often afterwards, like what's the follow-up? It's my understanding that once you're finished, there's really no reason for most of your clients to see you. There's not an issue, right?
Yeah, most of the time I just tell them, call me if you need me. You know where I'm at, So, but with the snap-in dentures, they take them out once a day and rinse and clean them. If they need anything, they call me. But pretty rare. And with the permanent teeth, as long as they're using their water pick and keeping things clean, I rarely see people after it, so yeah, it's nice. So.
All right, let's grab another phone call here and talk to Sylvester. Sylvester, thank you for calling. You have a question for Dr. Ackerman.
Yes, I do.
All right, go ahead.
A few minutes ago, y'all said that it takes a while to get the tooth. Do y'all go ahead and put the screws in and leave them in for a while?
So are you talking about for dentures or like a single tooth?
For the single tooth, or like they said, you might have your biting teeth in the back missing.
Yeah. So the day I place the implants, you'll leave with a temporary on there. And you can still chew with that temporary, and for those 4 weeks, but it takes about 4 weeks just to get the nice, pretty, permanent tooth back from the lab. But still, 4 weeks is a lot less time than about 6 months to a year as with the other method. But you'll always have something. So I'll place the implants, or kind of what you call the screws, that day, and then you leave with a temporary that kind of covers up those implants. And if it's in the front, it'll look like a tooth and everything. And then you come back about 4 weeks later and you get the permanent tooth, the nice, pretty one. Yeah.
Good question. Thank you for the call, Sylvester. Let's grab another quick one. Jennifer joins us now. Jennifer, welcome in.
Hello.
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 Hi.
You have a question?
Yes, I do. I'd like to ask about my husband. He has diabetes. He's lost his teeth through that. He's obviously doesn't have a problem with infection, because he had a triple heart bypass the first of the year and came through it flying.
Okay.
So I'm just curious, would there be any issue why he couldn't have this done?
And that's a great question. I've definitely done a lot of patients that are diabetic. And kind of what I was saying, it is so minimally invasive that a lot of times, you can have these mini dental implants, even if you are diabetic or had heart conditions and things like that. So, I invite you to, if you can come to the office for a free consultation, and I can take a look, and definitely, but it sounds like he would still be a candidate. So
yeah, I think people are apprehensive because, if it was major surgery, then yes, there would be cause for concern.
Definitely.
But the fact that there's really no stitches, no cutting open,
So actually, this model can kind of help show how minimally invasive this is. Let's see if they can zoom in on it, because it's kind of hard. There we go. So the big hole, let's see, over here, That's for the old method, the surgical implants. And then the little hole, which you can kind of barely see.
It's hard to see.
That is the hole that I make when I place an implant. So a lot less invasive, very, minimal bleeding, no swelling. It is not major surgery versus, having this big hole placed in your jaw. So that's a lot of reasons why I can do it on, medically compromised patients and not have to change medication and things like that. Another question I get a lot is a lot of people have been told they had bone loss or periodontal disease. So they don't think they're going to be candidates as well. But they are most of the time, because I don't need a lot of bone. I just need a little bone. And usually once, if they get all the teeth out, that's getting the source of infection out. And so then they heal up and they got good bone and we can do the implants.
And I would imagine they feel better as well.
For sure. Yep. A lot healthier.
Yep.
Yeah.
And look better as well.
Yes.
Okay. 571-5263. We have one more segment if you'd like to squeeze in a call. We'd appreciate that. Again, Mini Dental Implants, Freedom Mini Dental Implants on Wave 3 Listens Live.
A message from attorney Mike Sullivan.
Wondering about getting your disability? Why would you even need a lawyer to help you? Getting disability approved is hard, even if you're legitimately disabled. I know it doesn't seem fair. My name is Mike Sullivan. Over 25 years I've helped people like you get their disability. I do this every day, and I've learned a lot in all my years about what you can and can't do. Don't take chances. Call me.
Call 888-587-0228. Call now.
When innovative cancer care is close by, it means family can be too. Because at Baptist Health, you have access to the latest cancer trials and treatments and your own dedicated team of caring cancer specialists. It's world-class medicine that isn't a world away. Baptist Health Cancer Care.
There's never been a better time to trade than right now during Toyota's last chance clearance. I'm Tim Jones back for Toyota of Louisville. And right now you can get $1,000 cash back on a brand new Toyota Corolla. Toyota of Louisville, a Swope dealership where nobody walks away.
I'm Johori, and I'm an actual client of Sam Aguiar Injury Lawyers. I knew I needed an attorney when I was just in really bad pain, and I was unsure if the guy had insurance or not. As soon as I called Sam Aguiar, they were right on it. Sam Aguiar took great care of me. What made me choose Sam was his reputation. They took care of everything, and they made it very stress-free for me.
Tim Jones on the pre-owned lot here at Toyota of Louisville, where Zero Down delivers this weekend, and we have a great selection of cars starting as low as $7,000. We want your trade. We're at home of the 7-day guaranteed appraisal. Toyota of Louisville, a Swope dealership where nobody walks away.
Helping you out with a confident smile, eating the foods that you love. Freedom Mini Dental Implants. We go to the phones. Questions for Dr. Regan Ackerman. And Kathy joins us first. Kathy, welcome in. Good afternoon, and thank you for watching.
Thank you.
You have a question?
Yeah. I've had 3 teeth on the left side, 2 at the top and 1 at the bottom. They were extracted about 2 years ago. Mm-hmm. So I wouldn't have to have the surgery.
No, if you had those teeth taken out 2 years ago, you're a candidate probably right now to come in and have the implants placed and replace those teeth with the mini dental implants. Yeah, because you've already healed up more than enough and you're ready to go. You just need to call and come in and have the consultation with me and let me take a look, and I could certainly help you out. Yes, ma'am.
All right. Mm-hmm. Thank you for the call. Let's grab another one here. I can't believe this. We have another Sylvester.
I know.
It's a beautiful name. Just not. It's pretty rare. Sylvester, welcome in.
Hi.
Hello.
Yeah, my question is that can you also close up gaps? I've always had a real nice set of teeth and a nice smile, but for some reason my teeth is gapped in the front. Can you close the gaps up?
What I can't
Close
understand.
a gap up.
Oh, a gap. Yes, sorry. I was having a hard time hearing. Yes, we can do that, you know, with the dentures or the permanent teeth. If you want that gap closed up, we can. I have some patients that have had that gap in the front, especially our fancy term for it is a diastema, and they want it because that's their trademark. And so we can keep the gap or we can close it. It's all up to you and what you want to do. So yeah, definitely. That's a good question. So,
it is up to you. And I do think sometimes it is a trademark.
Some people, I mean, and they want their teeth to look the same as they always have, and so they still want that gap, and I totally understand.
Yep.
So we make a denture with the gap or, you know, the permanent teeth. We can do that for sure.
All right. 571-5263. I think it's important to point out once again that the consultation is free. Obviously, this is a 30-minute show, limited time, and you maybe need more information. That's why we open up the phone lines. However, I have news for you. All the news is good news, but if you have questions that may be specific to you or a loved one, then the consultation, again, free.
Right, no charge. So, and I can go over everything with them. One thing we kind of haven't mentioned is a lot of people were told that they need major bone grafting or sinus lifts to have implants done, and a lot of times I don't have to do that because these are smaller implants. So if they've been told that and it was too expensive or they were too afraid, you know, please come to the free consultation, set up an appointment, and I'd love to take a look.
My guess is, and you can confirm or deny, my guess is that you hear this expression a lot. Why didn't I do this sooner?
Yes.
Why didn't you hear that a lot?
I do hear it a lot, yeah. A lot of people, you know, or they were afraid.
Right.
So many times they, you know, when I'm, you know, putting an implant in on a patient, I can tell they're a little anxious, and I get one in and they're like, that's it? I'm like, that's it. And then it's just like a sigh of relief, and then we put the rest of them in, they're like, that wasn't as bad as I thought.
Because I think we've all been, you know, been jaded a little bit from childhood experiences. We're afraid of the dentist, but this is very simple and very minimally invasive. Let's take a look at Chris again, okay? Look, before and after Chris, there we go. See, to me, not only can I see the beautiful smile, but the difference between the before and after, the confidence, to me, is pretty obvious. And the first one, he's smiling, he's been asked to smile. And the second one, that looks like a genuine
He was ready to go on the second one. The first one I had to, like, tickle him, like, come on, smile.
You didn't have to tickle him in the second one. Yeah, I would think there's a lot of people very proud of their smiles, because we've all seen people, whether it be at a party or at an event, and they take their hand and they, you know, when they're talking to you, because they're ashamed of their smile, and that is a shame in itself.
It is.
It's sad.
And I have a lot of patients that do come in and say that they think people think they're upset or they're mean because they don't smile, and they're embarrassed, and they're not at all. And because once I get to know them on a personal level, I mean, they're the nicest people in the world. And then when I'm able to give them that smile back, I mean, it's rewarding to me as well as to them and life-changing.
Yeah, sure. I want to talk about that on from your perspective. I mean, from being a practicing family, general dentistry as they call it, and now you're changing lives for the better, people able to enjoy food. It must be great for you. This is a new gig. It's fantastic,
nice.
right?
I get a lot more hugs, you know. It's really nice. I mean, I can think of 2 patients this morning. She was like, I just can't thank you enough that you've changed my life. I think last week we had this big bouquet of flowers sent to us because she was so happy, and it's just, it makes me feel really good about what I do.
There we go.
Sure.
Hundreds, thousands of patients. Freedom Mini Dental Implant. Let's put the location and the information up on the screen. And again, remind everyone, free consultation, so it doesn't hurt to come in and ask, right?
Doesn't hurt. Come see me, right across from Valley High School.
There we go, right across from Valley. There's the number up on the screen. And as I said, the technology is about 20 years old, but if it's new to you, then I think you're going to be surprised. Minimally invasive, less costly. It's all good. They're durable. Eat the foods that you love and smile with confidence. All right, I want to invite everyone to have a fantastic day, and then we'll see you tomorrow for the Thursday edition of Wave 3 Listens Live. Have a good one.
Oh, I'm glad you